Hello, everyone. We'll get started at about 12:05. Let people have a chance to join. I hope everyone's doing good on this Thursday. It's almost Friday. And just to let everyone know, we have pre-recorded the webinar, so it'll be a presentation that's already done, and we'll answer any questions, or if you have any comments, we'll do all of those at the end of the presentation. So it'll be about 20 minutes. All right, wait for a few more minutes. Okay. I see a few people still joining. Tracy is unable to hear anything. Brenda, I see your camera's on. Can you hear me? Yes, okay. I'm not sure, Tracy. All right. Hello, everyone. We are excited to share some fun information about insurance. We know it's everyone's favorite topic, so we'll be spending some time talking about it and hopefully answering any questions you have. And so I mentioned this before, but we have pre-recorded this presentation. So if you have any questions, you can write them down. And then at the end of the video, we'll open the floor and we'll let you answer any questions you have. And we'll be also dropping some links in the chat as we go through, like our benefit enrollment form, change form, subscription agreements. And then we also have an option for you to schedule time with us one-on-one. So we'll have all that for you, and we'll go ahead and get started. Hello everyone, and welcome to our first webinar of our 4-part webinar series. Today we're going to be discussing insurance basics and enrollment essentials. My name is Mariah Hawkins, and I am the UUA Insurance Plans Project Coordinator. I use she, her pronouns, and I'm a mixed race woman in my late 20s with long brown hair wearing a taupe shirt. We're so excited for you to join us today, and we hope that the information we share with you is found valuable and used throughout your healthcare journey. Before we begin, I would love to introduce the team that works as the UUA Insurance Plans team. We have myself, Mariah Hawkins, as the UUA Insurance Plans Project Coordinator. We have Ashley Anguiano, the Insurance Plan Specialist. We have Hugh Dennis, who was newly added this year as our Deputy Director of Church Staff Finances. And we have Richard Nugent as the Director of Church Staff Finances. Together, we bring a range of skills and perspectives to ensure you get the best support and information. We're so excited to help support congregations, administrators, and employees navigate their benefits. At the heart of our webinar series is a commitment to equipping administrators and plan members with the confidence to advocate for themselves and their families. In today's presentation, we'll walk through key topics designed to clarify essentials and answer common questions. So let's take a look at what we'll be covering. Some of the key topics we'll be exploring today are benefits of joining the UUA health plan, an explanation of key health terms like deductibles, out-of-pocket maximums, understanding enrollment and changes timelines, a walkthrough of the essential forms and documentation for enrollment, an introduction to our subscription agreement, and tips for avoiding common mistakes when enrolling or making changes.
Hello everyone, my name is Ashley Anguiano, pronouns she, her. I'm a Latin woman with dark brown hair, black framed glasses, and a beige shirt, sitting in front of a dark green wall. I'm the insurance plan specialist and will be highlighting some of the benefits of the UUA health plan. One of the most important benefits we want to highlight today is the member support we're proud to provide. When you reach out to the UUA insurance team, you're connecting directly with one of us. Whether you call or email, we personally manage every inquiry that comes in, which means you get timely and compassionate support from someone who understands. Our goal is not just to answer your questions, it's to help you feel confident and cared for when navigating your health benefits. Another unique benefit we offer is coverage for infertility and fertility treatments, something we know can be both deeply personal and financially significant. These benefits do vary by plan. Under the standard PPO Gold plan, fertility services are covered at 90% after the deductible is met when using in-network providers, and 70% when going out of network. For the Silver High deductible plan, coverage is 85% in-network after the deductible and 65% out of network. And with the Bronze plan, benefits are covered at 80% in-network after the deductible and 60% out of network. Because fertility care involves a range of procedures and timelines, we do strongly recommend reaching out to our team before beginning treatment. We can help you confirm coverage details for the specific services your provider may bill, and make sure you're aware of any waiting periods that might apply. Our goal is to make sure you feel supported and informed every step of the way. Infertility and fertility benefits are not commonly included in many health plans, which is why we're especially proud to offer this coverage to our members. We recognize how important and life-changing this support can be, and we're committed to making sure our members have access to the care they need during this journey. Under our standard PPO Gold plan, the services shown here are covered at 100% network with no deductible required. Preventative care, including things like annual physicals and screenings, are covered at 100% network for all of our plans. Out-of-network coverage for preventative care does vary by plan level. For the standard PPO Gold plan, if you use an out-of-network provider, coverage is 70% after the deductible is met. For the Silver High Deductible plan, preventative care is covered at 65% after deductible. And for the Bronze plan, it's 60% after deductible. For diagnostic services, allergy testing, and lab work, the Silver plan covers these at 5% in network and 65% out of network, both after deductible. And the Bronze plan covers them at 80% in network and 60% out of network, again, after deductible is met. As always, we're here to help clarify which services fall into these categories and what your coverage is like based on your plan and provider network.
Next, we're going to be diving into some key health insurance terms. We know that insurance language can sometimes be confusing or overwhelming, and that's totally normal. But having a solid understanding of these foundational terms can really help when you're reviewing your coverage, comparing plans, or even just trying to make sense of a medical bill. So let's dive into what these common terms are and why they matter. Next, we are going to dive into some key health terms. A premium is the amount you pay for your insurance every month. A deductible is the amount you must pay out of pocket for covered services before your plan begins to pay. The out-of-pocket max, or OOP max on documents, refers to the most you'll have to pay in a year for covered services. After reaching this amount, the plan will pay 100%. A copay is the fixed amount you pay for a covered health service. Example is $25 for a primary. Coinsurance is the cost of a covered service, usually a percentage. Not contracted, often expensive or at all. An EOB, or explanation of benefits, is a statement from your insurer showing what was billed, what was covered, and what you owe. A drug formulary is a list of prescription drugs your plan covers, often organized into tiers like generic, preferred, non-preferred, and non-formulary. Pre-authorization, also known as prior authorization, is approval from your insurer required before you receive certain services or medications. A preferred provider organization, or PPO, is a type of health insurance plan that offers flexibility in choosing doctors and specialists without needing referrals. PPOs cover both in-network and out-of-network care, though you'll pay less when using providers within the plan's network.
Next, we'll be reviewing our forms and documents, the resources you'll use most often when managing benefits. We'll walk through what each one is for and how to complete and submit them. We have two main forms that you'll use most often, the enrollment application and the benefit change form. The enrollment application is used for any new enrollments. This includes enrolling a new hire, adding coverage due to a qualifying life event, adding a dependent, enrolling in life or LTD after evidence of insurability approval, or during open enrollment. The benefit change form is used when there are updates to an employee's information. This could include a name or address change, a salary increase, or a change in health plan level. We always recommend double checking with our team if you're unsure which form to use. We're happy to assist in any way. We also have a subscription agreement congregations must complete. To participate in our benefit plans, congregations must have a subscription agreement on file with the UUA insurance team. This document formally enrolls the congregation in the plans and authorizes them to offer coverage to eligible employees. By submitting the agreement, the congregation becomes a subscribing employer. This is an important first step to ensure coverage access for eligible staff.
This is our UUA Insurance Plans Benefit Enrollment Application. You will go down and select your reason for application between new hire, adding a dependent only, a qualifying event, or if you are approved through the EOI process managed by Guardian. You will insert your 4-digit congregation ID. If you're a community minister or a retiree, you will enter self or 0000. That is 4 zeros. In section 1, you will enter which health plan you would like to enroll in. The gold, silver with or without HSA, bronze with or without HSA, or our Medicare supplement plan. If you are already in the health plan, you would select already enrolled. If you wish not to enroll, you will decline. Next, you will go to the Guardian Group Insurance plans. You'll select which plans you wish to enroll in. We have dental and vision, life, long-term disability, hospital and accident indemnity, or if you're already enrolled, you'll select already enrolled, or you can decline to all. If you select to enroll in any Guardian Group Insurance plans, you will notice that there is a hyperlink down here with an enrollment form for Guardian-specific plans that you will need to fill out and reattach by clicking on Browse Files and choosing the correct file. You'll select the coverage type, employee only, employee plus spouse, employee plus children or child, and employee plus family. When you move down to section 2, you'll go to the demographic information, the employee's name, employee's date of birth, employee's social security number, employee's physical address, employee's phone number, and email. The next section is section 3, the employment information. You will select the employment status, employed, retired, or self-employed, the hire date, which is 2-digit month, 2-digit day, 4-digit year, the benefit effective date with 2-digit month, 2-digit day, 4-digit year. You will insert the annual salary. This includes housing supplement if available. You will go to your hours worked per year. You are required to work a minimum of 750 hours per year, which is about 15 hours a week to be eligible to enroll in any of our plans. Next, you'll select your job function, and then the authorizing leader or administrator will put their information here. You'll click Next Page, Sign, and then if you have any comments or concerns that you feel would make anything clear for us as we are processing enrollments, please put them here and enter the enrollment. A confirmation will be sent to the emails provided, and if you have any further questions, you can reach out to insuranceplans@uua.org. This is our UUA Insurance Benefit Change Form. This is used to report any changes in employee status, like reduction in hours, termination, or a transition to a new congregation. Employees' income updates affect life and long-term disability coverages and premium amounts. Employee address change can also affect health premiums because we use the zip code to calculate those premiums. An employee's elective drop of coverage for themselves or dependents, an elective plan level change, an employee's name change, or an employee's death. You'll begin by entering the 4-digit congregation ID, the employee's full legal first and last name, email, phone number, occupation or job title, effective date of change, and then you will select the appropriate request type. If you are going to select benefit transition, the appropriate drop-down will apply, and the same goes for the rest of the options. You will fill out the information. Any special considerations or comments, please leave here. You'll hit Next. The submitter will put their first and last name, email, and we would love your feedback on how we are doing by using the 1 to 5 star scale. When you select Submit, you will get a confirmation email to the email address provided. The UUA has created and manages the UUA Employee Benefits Trust, which offers benefits through the UUA Health Plan. By signing this subscription agreement, you are choosing to participate in the plan and agreeing to follow the rules of both the plan and the trust. This makes you a subscribing employer. As a subscribing employer, you can enroll eligible employees, eligible retirees, and their dependents as defined in the plan and trust, based on the choices you make below. To begin the subscription agreement, you will put the name of your congregation, tax ID or EIN, the physical address, the phone number, email address, and then you will select which benefits you will be offering to your employees. We have our standard PPO Gold, high deductible PPO Silver and Bronze, as well as our Medicare supplement, dental and vision, life insurance, long-term disability, as well as our indemnity plans. As the employer, you have the option to select when coverage will begin for employees. The date of hire, the first day of the month following the date of hire, the first day of the month following a 30-day waiting period, first day of the month following a 60-day waiting period, or a 90-day period. It's important to note that although you have a waiting period, our 30-day eligibility enrollment period is still active. A 60-day waiting period, we must still receive a enrollment form for the employee within the first 30 days for health insurance and within the first 60 days for our Guardian group insurance plans. The same goes for the 90-day waiting period. We must receive the enrollment form within the first 30 days, even if you select the effective date as after that 90-day waiting period. You will then agree to the health plan employee eligibility section, and this is just stating that if you offer benefits to one eligible employee, you must offer benefits to all eligible employees. You do not have to contribute the same amount towards each employee, but it's important to note that it must be available for them to enroll. Every year we are audited to keep records of employee elections and have them available for the audit. Next, you will select the health plan employer contributions. You will fill out what you will contribute based on how many hours your employee. Any additional details you can put here. For payments made by the employers, they must be submitted by the 15th of each month and are payable to UUA insurance plans. We also send out delinquent notices once we receive those from our billing office. After so many attempts, we would terminate benefits if we do not hear back or the accounts are delinquent for an extended period of time. You can receive a copy of our plan and the trust if you reach out to us at insuranceplans@uua.org, or you can visit us at www.uua.org/insuranceplans. To complete the form, the treasurer will insert their first and last name, their 4-digit congregation ID, a signature, and a date. You can get a PDF copy of this upon submission, and then you will press submit, and it is completed. Next, we're going to talk about enrollment and changes timelines. For new enrollment, you must complete an online enrollment form within the first 30 days of hire for health insurance and within the first 60 days of hire for our Guardian group insurance plans. It's important to meet those deadlines, especially for life and long-term disability. If you do not make the enrollment within the first 60 days for life and long-term disability, you will be required to go through the evidence of insurability process. This can take a little bit longer and requires medical underwriting. Open enrollment is held in November of every year with a benefit effective date of January 1st of the upcoming year. We will send out multiple reminders to make sure that everyone is in the know. For any benefit changes, you must submit a benefit change form within 30 days of the change, such as an employment termination, a benefit termination, change in hours worked, address change, income updates, or a transition to a new congregation.
To wrap up, we want to share some of the most common mistakes we see, and more importantly, how you can avoid them to ensure smooth processing and continued coverage.
If your congregation offers benefits but has a waiting period, be sure to submit enrollment forms as soon as possible to avoid missing the enrollment window. Even if the benefits won't start right away, you can still select a future effective date, such as after a 90-day waiting period, as long as you receive the form within 30 days of the employee's start date for health plans or 60 days for Guardian plans. When an employee is moving to a different congregation, be sure to submit a benefit change form and select benefit transition instead of employment termination. Submitting a termination can disrupt their benefits and they would have to re-enroll. When an employee is transitioning to another congregation and electing to enroll in new benefits, they must also submit a benefit enrollment form. Selecting benefits on the benefit change form alone will not complete their enrollment. Social Security numbers are required when submitting an enrollment. If an enrollment form is submitted without a Social Security number, it will be considered and will not be processed. When submitting an enrollment or change form, be sure to use your full legal name, not a nickname or preferred name, to avoid billing errors and processing delays. It's important to remember that if an employee changes their health plan level mid-year, their deductible will reset and start over with the new plan. And that concludes our presentation for our webinar today. We really want to thank you for spending time with us and getting to learn more about our insurance plan. If you think of any questions later or need help with anything benefits related, please feel free to reach out to us at insuranceplans@uua.org or give us a call at 888-792-7496. We will also drop a link in the chat where you can schedule a one-on-one call with Ashley and myself, and we can talk things through a little bit more privately. If you have any other questions, we're going to open the floor, and we thank you so much for being here. All right. I hope everyone didn't have any trouble hearing or seeing the screen, but we'll also send out the video of the presentation. So if you wanted to reference it at a later date, you are more than welcome to. So now we will open the floor, and I do see we have a question in the chat from Stacy. Can you go over prescription coverage? Stacy, if you want to unmute and maybe specify what coverage you were or what details you were looking at getting for prescriptions.
Yeah, thank you. I just specifically, like, when you've met your deductible, do you still pay, do prescriptions follow the same rates that you described at the beginning when you talked about coverage, or do prescriptions not follow the same, like once you meet your deductible, are they still the same cost?
Yeah, so that's a great question. So prescriptions, depending on the plan that you're on, and so I'll go off the standard PPO Gold plan. So that plan does have a prescription deductible. And so you don't have to meet your complete medical deductible, as a prescription deductible is quite less. So it's $250 for individual, $500 for family. Depending on the tier of the prescription, there may or may not be a copay, and those copay amounts may be different. So it's hard to kind of give a blanket statement, so to speak. But as far as the deductible goes, it is different when it comes to the prescription, like I stated. If you have questions about a specific medication, we do always recommend to reach out directly to us, and we can get those specific coverage details to you.
Awesome. And feel free to just unmute yourself if you have any questions, or you can raise your hand. I see Lisa sent a question. When a minister transitions from one church to another, would they submit a benefit change form stating the transition and another to change address? Same form for both changes. So you would need to submit the benefit change form to transition and another one for the address change, right, Ashley?
Yes,
Okay.
correct.
I was second guessing myself.
I will say that we are currently working on revamping that change form, so to speak. We're actually working along with the retirement team to create an all-in-one form, which would make it easier for you to submit changes for both retirement team and anything insurance related, and as well as submit multiple changes in one form versus, like Lisa stated, having to complete two of the same form for different changes.
Thank you.
Do you have any information about Highmark's coverage for GLP-1 drugs? It seems there have been increased requirements for people to be able to access or continue using them.
Yeah, so the GLP-1s, the medical policies around them are being reviewed. There is a high usage of them, and due to that, insurance companies are kind of reviewing the medical policies around them. It is something that we are going to be reviewing further for the upcoming year. We don't have any more details than that, unfortunately, at this time. But it is something that the UUA is wanting to continue to advocate access for them. We're just kind of waiting to see what the insurance, what Highmark themselves are kind of looking at going forward.
Perfect. And Jen, if you have any follow-up question on that, feel free to unmute or ask before I move on. Okay. Laura Park has a question. They have a minister moving from a United States congregation to a Canadian congregation. Could you say what's different about what I should do? So we do have some ministers who are in Canada, and you would submit the benefit change form as usual. Transitioning, they should also have a congregation ID. So you'll just input all the same information. We are trying to get more clarity around health insurance, being enrolled in insurance plans that are based here in the United States and having a minister who's in Canada. So that's something that we are looking into at the moment, and we're trying to figure out what those rules look like, because we do have some who might live in the United States, go to Canada and work and then come back, which could be also a little different. So that's something that if you had a specific question on, I would say email us so that we can message you directly regarding that. But submit the benefit change form, select benefit transition, and put the congregation ID, and all billing will be transferred over to that congregation.
What if she doesn't want the billing transferred over to the other congregation? I mean, I guess it sounds like I need to find out what benefits the new congregation will continue.
Mm-hmm.
Yeah, so if they're going to continue any benefits, then it would be a transition. You submit that change form. If they're not going to continue any benefits, it'll still be the change form. It'll just be a termination to terminate those coverages and get them off the billing.
Okay. This is a Canadian citizen, so I think we're just terminating everything. Thank you.
Yeah, of course. All right. If employees are being denied, what should they do? Oh, that's in regards to the GLP-1s, I'm assuming. That was Jen's fault.
I couldn't unmute fast enough. So yeah.
You're fine.
Yeah, Jen. So if anyone's being denied, have them reach out to us. They can email us at insuranceplans, that's plans with an S, at uua.org. We can review the denial with our Highmark account manager and get further detail into what's causing the denial, and take it from there. But we highly advise to reach out directly to us so we can help work through that denial.
And I would just say, sort of anecdotally, what some of our folks are getting is Highmark is asking for increased requirements. So they're being told that they have to, be working with a nutritionist or be going to a gym or something like that. And they're not being told that. It's not being said to anybody proactively. They're finding out when they're going in to refill a prescription, right?
Got it.
They're being either denied or told they need to pay full price, right?
Got it. Yeah, definitely reach out to us. Like I said, we can look further into that and also review history for those members. Like you stated, they were already on the medication, but it looks like now maybe the requirements changed for that. And so we can, like I said, dig further into that and, take it from there as far as next steps go. But definitely reach out to us at insuranceplans@uua.org.
Awesome. Griselda asked, is a role change from care coordinator to intern minister, would that be a qualifying event, part-time to full-time, and it's required to fill a benefit change form? Yes, so that would also, if their hours weren't meeting the minimum requirements to be enrolled in the plan, if your congregation offers it, that would also be a qualifying event, which would allow them to enroll in the plans. So you would submit the benefit change form with the increase in hours. And then you could also provide the information to that employee, letting them know that if they weren't eligible before, they are now eligible and they can submit the enrollment. The time frame is still the same. You would have to do it within 30 days for health insurance and then within 60 days for our Guardian group insurance plans. Perfect. Are there any other questions?
Yes,
You're
I have a
welcome.
question.
Yeah.
I'm a new benefits coordinator, and we are having a new minister come in who's I'm not sure what her coverage is at her old congregation. As the benefits coordinator for the new congregation, uh, do I fill out a new hire form? What form do I fill out? And what are my responsibilities?
Yeah. And you're just someone coming from a different congregation to your congregation, correct?
Right, in the United States, yes.
Yeah, so that's when you'll submit the benefit change form as a benefit transition. So if they were enrolled in benefits at their prior congregation, either you as the new congregation's admin or the old congregation or the employee, there's no rule around who has to submit the form. Typically, it's whoever has all the information that's required. So you'll just submit that benefit change form as a benefit transition, and then you'll have a place where you put the benefit effective date. So if they're going to go over on August 1st, you'll put August 1st as the effective date, and all billing from August 1st forward would be moved to your congregation.
Okay. And the other thing is that form you said, since this is we haven't had anyone have health insurance. Our ministers have always been older. They've been on Medicare. So I don't know if we have that form. How do I find out whether we have the
The
health
subscription
insurance?
agreement?
Yeah, I think we must have, because we did pay health insurance in the past. But
Yeah,
I don't know. How can I get a copy of it?
for sure. So we can look. We have a tracker that shows us all the subscription agreements that we do have on file. We do recommend, if it's outdated or if y'all aren't sure of what you are offering in the past subscription agreement, that you just resubmit it so that you have current contributions for your employees, and the coverages that you offer are up to date in our database as well. So you can just go in and easily resubmit it, and we'll replace, if we had any prior information, we'll replace it with the updated information. And it doesn't hurt if it's the exact same, but you'll also be able to download a copy for y'all's records as well once you submit that.
Yeah, and if you reach out to us via email, we can let you know what the current elections we have on file for you. And that way, you can make a decision whether those need to be updated or not.
Okay. Yeah, Kit, if I email you, can you send me a copy of that document?
Yeah, definitely.
Thank you.
All right.
All right. So I see Anne asked about the prescription through the mail order. So I did drop the link for that home delivery prescription. So there's two ways to kind of go about it. You can log in directly to your Highmark member portal, which is going to be through highmarkbcbs.com. There'll be a tab under there, prescription section. You'll be able to view your active prescriptions. If you want to switch over any of those, you should be able to click directly into them and then transfer it to home delivery. And they'll take care of reaching out to your provider to get that transferred over. Usually does take, I would say at most around 30 days, kind of depending on whether you're needing, to have refills reauthorized on that prescription or not, and kind of where you are as far as that prescription running out. The other option is also to let your provider know directly that you're wanting to transfer your prescription over to Express Scripts. Most providers already have Express Scripts in their files, so they can just go ahead and kind of switch over who's filling that prescription. I would say the latter is usually easier to just make that request directly with your provider versus, Highmark reaching out. And sometimes I have noticed personally that there is a bit of a delay with the provider processing the request directly from Highmark versus when it comes directly from you.
All right. And so I see Julie, you're rejoining the UUA health plan in July. When do the cards arrive for the plan for new/returning enrollees? It does take 1 to 2 business weeks to receive your cards in the mail, but you can also access PDF copies of your cards using the Highmark member portal. And I'll include a link to that portal. And you would just sign up, and once we process your enrollment has to be processed before it's actually in there. So we process them on Fridays, and they're typically available to view in Highmark system middle of the following week. So if you are already submitting that enrollment form, it should be updated in July, within that first week of July. So you can just sign up and get a PDF copy if you need to have any appointments or prescriptions picked up.
And then I do want to add that if you've already submitted that form, even though we will have processed it, you won't be able to create a member account and access your ID cards until your effective date. So let's just say you've already submitted the enrollment form and it's June. We'll process it in June, but Highmark won't allow you to create a member account until July 1st, which would be your effective date, I'm assuming.
All right. And I'm having trouble pasting that link in there, but I can email that over to you, Julie. I believe I might have spoken with you over email, so I can just send you one directly.
Got it.
Oh, thank you, Ashley.
Mhm.
All right. Any more questions? We're happy to answer them. We still have about 15 minutes. But like we said, if you can't think of any questions at the moment, we are available to answer your questions via email. That's the best way to contact us, just because Ashley and I are the only ones who manage the insurance phone. So if you get voicemail, it's typically because we're either in meetings or the timing is just off, or we're already on calls. So email is the best way to reach us. We're very responsive to emails, and we try to get all of your inquiries at least responded to within one business day.
And then I did drop in the information for our webinar number 2. Like Mariah stated, this is a series kind of breaking down all of our insurance plans. So webinar number 2, we're going to be comparing the health plans and going into further detail for that benefit for the plans, as well as HSA and covering other online tools. And so that link to register is right down here. it'll be just like this one where we have it recorded, and we'll go ahead and send that recording out after the fact as well.
All right, last call for any questions before we head out. Thank you, Lisa. She said, "You guys rock. I do appreciate your prompt responses and valuable assistance. We love what we do. We enjoy talking with everyone. And, like I said, if you have anything that needs, a little more attention, schedule a one-on-one call with us. That way, you have our undivided attention for that full 30 minutes where you can ask any questions. If you have any issues with claims, Ashley is amazing. And she does wonders with it. We're excited to help, and we're here for it. Well, if there's no other questions, thank you so much for joining us, and we are so excited to continue on this webinar series. We will have all of the webinars recorded, and we'll upload them to allow you all to rewatch them or share them with administrators within your congregations, employees, whoever might benefit from it. So yeah, thank you so much, and we will see you on July 22nd at 12 Eastern for our second webinar. Have a great day.
Thanks, everyone.